During the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are certified healthcare, home healthcare agency located actually Palm Beach County, Broward, and Miami-Dade. You can reach us at 954-717-7027. I'm your host, Louise Gomez, and today we have Dr. Azim and Dr. Nashir Sachedina. And they are, let me get you the address. You're going to want to get this information. 1670 University Drive, Suite A, right here in Coral Springs, Florida, 33071. They can be reached at 954-227-6747. The website is SACHEDINAUROLOGY.com, Sachedina Urology. Thank you for coming. Welcome to the show.
Thank you for having us. It's a pleasure.
Pleasure to be here.
You know, this is the first time we have a father and son. I am so honored to have you here, and thank you so much for coming. We do have a lot of questions for you. I wanted to talk about if you can just tell us a little bit more about your background and your history. Maybe we'll start with your dad.
Sure.
Let's start.
I was going to have him kick it off.
No, go ahead. Please do.
I've been in practice since 1985 and sort of grown with the whole field of urology. And over the years, we've tried to stay very modern, and we do the latest technology available where it makes sense. And it's been my pleasure over the last 8 years or so for Nashir to have joined me. And I think Nashir will tell you about some of the stuff that we do in the practice.
Mm-hmm.
Sure. So just a little bit of background on
Yes.
us and me. I grew up down here, so this is home. Went to Pinecrest Preparatory School for high school.
Nice.
Got away for college, went to Duke University, came back, University of Miami for med school, and then the University of Pennsylvania for my residency. So every time I tried to get away, I had to come back. And so came back about 8 years ago, joined my dad in practice, and it's been excellent. It's been a pleasure ever since.
So, Dr. Sachedina, if you could tell me a little bit more, what is the age range of your patients, and do you also see male and female?
So yes, we see both.
Okay.
And the age, any adults really, even some adolescent children on occasion, but in general, we don't do pediatrics. We do mostly adults.
Okay.
And we do provide a wide scope of treatment. So we handle a lot of different specialties that could include anything from incontinence to stone disease to prostate issues to major cancer operations. So a lot of practices have stopped doing some of the major cancer surgeries. And we've stayed on the forefront, and we're able to do we provide a robotic surgery, and there's a lot of technologies that come and go. But the technologies that really make sense to us, that have really stood the test of time and we think are really work for our patients, is the ones that we stick to. So we try to be modern. At the same time, we try to really have strong principles of technology that's already worked for us.
You know, AI and robotics, people, I mean, that's just, you know, nowadays it's just so people are wanting that. They're feeling that it's just the cutting edge of technology. Sure. What is the most common procedure that you would do with AI, if you can share with us?
So I think AI in and of itself is coming, but I don't think a surgeon or a doctor could be replaced at this point. I think, you know, when you talk about robotic surgery, it's robotic assisted surgery.
Okay.
So, you know, the robot is in your hands.
Thank you for clarifying
opposed
that.
to,
Yes.
as opposed to just hitting a button and saying, just go, you know. But I think, as my dad said, we have to evolve with the technology, and, you know, the more you can apply technology in there, so in some points, it's going to help you with
Okay.
patient outcomes. At some point, we have to, the surgeon has to step in. So,
Right.
Again, I think the field evolves with technology.
So what is the most common procedure that you do with the robotics?
So as far as we're going to be talking momentarily about robotic
Sure.
treatment of an enlarged prostate, which is new
Okay.
technology. But in general, if you
Okay.
look at robotics, it was introduced in this country about 2002.
Okay.
Its first major case is done with robotic surgery. Really sort of picked up speed over the early 2000s. I started doing robotics in 2009. And so you can do all these surgeries with very short hospital stays or outpatient, minimal pain, and with even better outcomes because you're seeing things 10 times magnified and
Wow.
you see 3D. So the robotics part is really nice. But the thing is to apply it in a way that makes sense. Just
Right.
because it's new technology,
Sure.
it doesn't mean it's always better for everything.
True.
So, but like I said, we do a lot of other things also. So.
So now, do you accept major insurances at the practice?
We take most major insurances. We are obviously Medicare, Medicaid, all of that. But most commercial insurances, yes.
Okay, wonderful. And how soon, if somebody's listening right now and they say, you know what, I really need to make an appointment, what do you think the wait time would be for someone to call in and make an appointment?
Sure. So for routine stuff, we try not to keep it too long, so a week or two.
Okay.
Obviously, if it's an emergency or a patient needs to be seen sooner, we do make that accommodation and we'll make it happen.
Okay, wonderful. So can you speak into a little bit more about what is the most common thing that people, maybe men, is it an enlarged prostate or what? You tell me, what is it?
Sure. I think the most common thing by far is an enlarged prostate. So as the man gets older, prostate's going to enlarge. What that does is it obstructs the flow of urine and causes irritative symptoms. And so you talk about half of guys in their 50s, 60% of guys in their 60s, and that escalates 10% with every decade. So it's very, very common. Guys are going to have frequency, urgency, incontinence, waking up at night, some decreased flow. And so that in and of itself doesn't sound that bad, right? But the frequency, urgency, you think about it, that could be pretty severe. If you constantly need to know where the bathroom is, if you have to miss your child's recital because you have to walk out and go use the restroom, you miss the punchline of the climax of a movie or the end of a game or something like that. And also from incontinence, some people are afraid to leave their houses because they're afraid, they're embarrassed, they're going to wake up, they're going to leak. And then as far as waking up at night, again, doesn't seem like a big deal, but I get upset when I wake up once at the night with the phone call.
Right.
There are guys who are waking up 3, 4, 5 times at night, and not to mention how it affects their partner who's waking up at those times too. So it takes a stress, an emotional toll on everybody. It takes a production toll with people affecting work. So it is a big deal, and it happens to a lot of people.
So it sounds like it's kind of common from what you said. Is there anything that someone can proactively begin to do now before they're going to make the appointment, they're going to see you, but is there something that maybe you could suggest that they take a proactive step before they see you, or what do you think?
There really is nothing that you can do to
Really?
prevent the enlargement other than taking medications, which people are not
Okay.
going to do
Right.
as a preventative measure. So it's not like you can change your diet or
Right.
to affect that. But what happens is the patients come into our practice at all different levels of difficulty with the condition.
Okay.
So the whole idea is to tailor the treatment to the patient. So somebody who is just having a little bit of difficulty, we may look at just giving him medication, and the medicines work very well
Okay.
for that level. On the other hand, you have other people that walk into the office, they've been so scared of having anything done,
Yeah.
and this is 10 years later, and
Yes.
the kidneys are shot because
Wow.
they
Is that
waited too long,
Yeah.
and the bladder is full and it's backed up. And there's all grades in between. So the idea is to apply whatever treatment recommendations we have for that particular patient and make sure it's the right decision for them. Because we have all these technologies.
Right.
And there's a vested interest in in certain situations to do one thing or the other. But what our focus is to get the best outcome possible for that patient in the shortest amount of time, so we don't have to redo treatment, so we don't have to have them keep coming back to the office.
Right.
And maybe you can talk about some of those treatments.
Sure. So as far as treatments, traditionally you would scrape out the prostate. That's called the transurethral resection of the prostate, or a TURP.
Is that a surgery, or is that twilight, or can you get
It's
a little
it's-
bit more into
sure,
that?
It's
Yeah.
general anesthesia,
Okay.
so it is a procedure.
Okay.
And that's scraping out the prostate. And, my dad loves it, and he'll go on for hours about it. But it's a great procedure. It gives excellent outcomes when done right.
Okay.
And so that's going to remove the goal of that is to remove all the obstructive tissue
Okay.
and free up the channel. And so when you look at all the other procedures and technologies and so on, they're comparing to the TURP as the gold standard.
Comparing to the what?
The TURP, the
What is-
procedure, the
Okay.
TURP, the scraping.
Okay, that's what it is called.
And
okay.
so you have minimally invasive procedures. We do the resumes, the urolifts, and those are procedures in the office where you either push the prostate aside and open up the channel, or inject steam into the prostate and melt away the tissue with hot water vapor. And then we're, in the operating room, we talk about doing the TURP, the TURP, and there's the newer technology, which, we'd love to discuss as well, the aquablation.
Yeah, please. I was going to ask you.
Sure. You want to go ahead?
Oh, absolutely. So, as Nashir said, all these minimally invasive technologies, they do a little bit and they make you better. But it doesn't take you back to being like you're 20 years old.
Okay.
And what I tell my patients is, if you come for your prostate condition, we can literally have you urinate like you're 20 years old. The scraping is a fantastic procedure. It gets a bad rap in the media and on the web, but it's actually...
Why does it get a bad rap?
Because there's all these other competing technologies
Okay.
that want to say how bad it is so that they can push their product. The example I would give you is, if suppose one car brand, like Lexus for example,
Right.
stops advertising and all the other car brands come out and say, our car does this and our car does this and our car does this. All of a
Right.
sudden you're going to think Lexus is a bad car.
Right.
It really isn't. It could be as reliable, as good as any other car, but if other companies say bad things about it, that becomes an issue. So if they talk about all these complications of incontinence and bleeding and all this stuff, that may be from 50 years ago, but they still use it. So bottom line is that as I think as effective an operation for any medical condition that there is.
Right.
So if you have the right patient, you do the TURP, literally you can take them back to being like they're 20 years old. That's been my
It's been his experience.
And I know the patient's going to do fantastic. Now, let me talk about the aquablation now. So what happens?
Can we take a quick commercial
Of
break? Because
course.
when we come back, I want to talk about the aquablation, and then I also want to talk about as far as the female perspective and what do we
Absolutely.
have for remedies for a lot of females have this situation as
Absolutely.
well. So we're going to take a quick commercial break, and then we're going to come back to that. So please hold
Absolutely.
that thought. Thank you so much. All right, we'll be back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks for coming back to the You and Your Doctor episode we have here with Dr. Azim and Nashir Sachedina. They are located right here at 1670 University Drive, Suite A, right here in Coral Springs, Florida, 33071. You will want to write down their phone number, 954-227-6747. Please look them up at sachedinaurology.com. Thanks for coming back. Please continue, Dr. Sachedina, on what you were saying because it's important.
Sure. So we talked about the TURP, and I'm going to talk about the aquablation in a second, but I also want to stress that not everybody is a candidate for that kind of surgery. So a lot of younger patients, for example, they may want something less invasive. So we offer things like Urolift.
What is a Urolift?
That's what he was talking about.
Oh, okay.
So the Urolift are little clips to basically push the prostate out of the way. I sort of think of them like curtain stays. So you push the curtains away, you rope them in, and so that's what the prostate does. It ropes out the prostate.
Okay.
And also the Resume.
And the Resume is hot water vapor therapy. So injections into the prostate melts away the prostate tissue, and over time the channel will open up. Those are minimally invasive office procedures, so they do have their advantages there. With them, there's less than 10% chance of having sexual side effects, which is always, a concern with some of the other procedures. And so then we talk about aquablation, which is sort of the marriage of the two, a minimally invasive procedure with removal of all the tissue. And so do you want to talk about this?
Sure. So the aquablation is basically like a TURP, but it's done, it's executed by a computer. So that is actually truly robotic surgery. So we basically use ultrasound and we line up exactly what we want the computer to cut. And like a self-driving car, you have to be there. You can't just let it run haywire. But it actually provides very, very precise clean out of the prostate in the exact location. So it is the latest technology that there is, sort of like going through a car wash. It just washes out all the inside of the prostate, if you will, with a water jet that is not hot. So theoretically, there's fewer issues with urgency and frequency. And the only place in Broward County right now that has the equipment is Northwest Medical Center. So it is a $500,000 machine that they've invested in. But I think it's worth every penny because we think it's fantastic technology, and we think it's the technology of the future.
What I like is you have options.
Right.
You have a lot of options. Go ahead.
Absolutely. So what I wanted to add to that was just in concept, what aquablation is basically pressure cleaning out the prostate. So it's
Thank you for the layman's terms.
It's high pressure water. Right. So if you pressurize water enough, you can cut through steel. Right. So this is a robotic arm that goes into the urethra, into the tube you pee from, while you're under general anesthesia. So it's not uncomfortable for you.
Sure.
And the robotic arm, will squirt out this high pressure water and basically pressure clean the prostate using the ultrasound as a roadmap. So it's very precise in removing the tissue, just like the TUR would be, but minimally invasive in the sense that there's no heat. We're able to maintain our landmarks, quicker operative time and quicker recovery time.
I'm going to have people are listening. They may want to call in. So I do have a number. Please call in if you have any questions. We have two experts here right now that are able to answer your questions. Please call 888-994-4995, Studio A. So if you have any questions, please call in. I have a quick question for you. Is this genetic, or is this something that is just lifestyle, or what is the situation with that?
For the enlarged prostate?
Yes.
There is a genetic component in the sense that you're going to see people have prostate issues in their across generational lines. That being said, an enlarged prostate is not always bothersome. So you have these people with huge prostates who have no problem.
That's interesting.
Then you can get a guy with a small prostate, and it's causing so much of a blockage that it's really affecting their quality of life.
Wow. I had no clue. So if anybody's listening and they're curious and they want to call in, please call in. this is amazing. And what I like, what I was saying before is you have a lot of options because people want options. They want to say, well, maybe I don't want to do that right quite yet. Let me
Exactly.
Absolutely.
right? Let me start with step 1 before I go to the step 2 and 3. Now, Dr. Sachedina, can you please speak into female challenges? Because I've heard women my age who've had, we've had children. We want to talk about this sling. What is that about? Or can you speak into that?
Sure. The sling is usually for stress urinary incontinence.
Okay.
So women that leak when they cough or sneeze.
Okay.
And depends how much other abnormalities involved. A lot of times it's associated with the drop bladder or associated with other issues with the uterus. And a lot of times that's handled by a urogynecologist.
Okay.
So we will evaluate them and see what we feel comfortable doing.
Understood.
And if we're comfortable, what the mantra should be, whatever we do, we should do as well as anybody out there.
I like
And
that.
if it's not that, then we need to refer you to somebody
I
else.
like that.
So, but you asked specifically about slings.
Yes.
So they do work very well in the right condition,
Okay.
in the right situation, and they're highly effective.
So I think my main takeaway from this is people are listening and a lot of people are fearful. Come, call, find out, get an
Absolutely.
appointment, right? You don't know until you get an
Absolutely.
evaluation.
For sure.
Because I feel like some people might have come to your office and then they get an evaluation, and they do a procedure, and they're like, "Oh my God!" Like,
Night and
can
day.
you tell us a story? Give us a couple stories, please.
Sure.
Do you have it? I'm sure you have.
I'll talk about our very first aquablation procedure that we
Please
did a
do.
few months ago. The gentleman had been walking around with a catheter for
Wow.
7 months.
No way.
And he had been uncomfortable. He was bleeding.
Yeah,
Another
that's
urologist got a hold of him in the hospital. He says, "Can you please help us with this case because this patient is bleeding and we can't control it."
Yeah.
And we did him as an emergency. We had planned to do several cases the following
Sure.
day, but we did him as an emergency. And that gentleman now is absolutely back to normal. He's got a
Wow.
smile on his face. He's got a whole new zest for life.
Of course.
So that kind of stuff is fantastic.
Those are amazing stories.
Right.
Quality of life.
Yeah, so I think one of the big things with urology is you can do some smaller, minimally invasive procedures and make a huge difference in someone's life. We talk about kidney stone pain. Some people say it's worse than childbirth.
Yes.
And you can do a procedure less than an hour, and all of a sudden they're back to normal. That pain's gone, and they have the biggest smile on their face. So you can get these high reward procedures very quickly, and it's rewarding for us.
So what is like a kidney stone procedure? Is it like a laser where you break it down?
Sure.
Can you speak into a little
So
bit
it
more?
depends on the size, where the stone is, what it's made out of.
Wow.
But traditionally, there are really 3 options for treating a stone.
Okay.
One is a laser procedure, which is where you go in with the camera, the opposite way the urine flows. You drive a camera up to the stone, break it up with a laser under direct vision. It's sort of like playing video games, right?
This is great.
And
This
so-
is great. I'm
And
loving
so
it.
that's probably the most common. That's definitely the most common in what we do. Some of the other methods would be shockwave therapy. So where basically there's no instrumentation within the patient, but you have the patient lying down and you're able to see the stone on x-ray and you target shockwaves to that stone and
Wow.
break it up. It's sort of like throwing a bomb on that stone and saying, hey, let's see what it does.
Wow.
And so we will offer that. And then the last is the PCNL, which is,
What
you want
is
to talk
that?
about
Yeah,
PCNL?
please.
Sure.
speak
So
into that.
there are some stones that are so complex
Okay.
that we actually have to make a hole in the side, and then it's actually not as bad as it
Okay.
sounds. It's actually, in the old days they used to have a big incision, open the kidney in half. We don't do that kind of stuff anymore.
Okay.
Nowadays, with what we do is under X-ray guidance, we can actually put a needle right into the kidney. We can stretch the tract open. So you're talking about an opening about that big.
Sure.
It's sort of like laparoscopy, but we go right into the kidney and we use either laser or other sources of energy to just get rid of the stone completely.
Wow.
Goal is to try to do it all in one visit if we can, one
Makes
trip to the
sense.
operating room. If you treat that same stone different ways, then you might end up having to do multiple procedures. And sometimes it's necessary and we do it,
Sure.
absolutely. But
Sure.
the idea is to give the patient the best outcome with the least number of procedures with the most success.
I like that. Best outcome, least number of procedures with the most success. So I always like to end my interview. I can't believe how quickly this
It
has
flew
gone.
by.
You
It flew by.
gentlemen have done such a tremendous job, and
Thank
thank you
you,
so
thank you.
much for coming. But I always want to end this, and I always ask my doctors, can you, in summary, what is one piece of advice you can give? Obviously, you're a urologist. What is one piece of advice you can both give to patients, to people out there listening right now? Is there anything you can maybe shed some light or some advice to anybody listening?
So, I guess I'll start.
No, go ahead, please.
Sure, please do.
So we have a lot of patients who come in who say there's trouble with their urination, there's trouble with their erections, there's trouble with their testosterone is all
Right.
just a normal part of aging, and they sort of dismiss it. And what I would say to people is we have therapies, solutions for all of that. It doesn't have to be a normal part of aging.
Thank you.
So speak up and see a doctor.
Thank you so much. And doctor, please.
I think have confidence in your doctor when you go
Okay.
in. Make sure that you feel comfortable when you go there, and
Mm-hmm.
you should be able to ask them whatever you want, and just have trust that the right thing is being done.
Thank you so much for your time. I really want to say that I appreciate everything, and anybody who's listening, really quickly, I want to give you their number before we leave because I know you're going to want it, 954-227-6747. Thank you so much. I appreciate you.
Thank you.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866